I was limited pretty badly for work, not being able to lift over 5 pounds, and I do construction, build pole barns, so it was pretty tough. Leisure activities as well, riding bikes, working on my truck, limited me a lot. Lifestyle leading up to the first surgery was rough, trouble walking, pain shooting down my leg, through my back, all the way to my feet. So I went to a chiropractor to help relieve some pain on the sciatic nerves, and that did not work out too well. And Dr. Gorey suggested a laminectomy.
I saw Luke 5 years ago for what's called a lumbar disc herniation, and that's usually a disease of the young person where a piece of disc breaks off, slips out of position, and puts pressure on the nerves that go down the leg. The disc is a soft structure between the bones and the spine, and it functions like a shock absorber, but over time with repetitive load, it can develop what looks like paper cuts, and it's through those paper cuts that disc material can then leak out and then irritate or compress a nerve. In most cases, we can treat that condition without surgery, but by the time people come in to see a surgeon, a lot of times they've tried physical therapy, injections, which are alternative options that we try first, and then after that is when you think about any type of surgery. Luke's second issue was what's called a recurrent disc herniation. So once a person has a disc herniation, that hole where the disc leaked out from doesn't always scar down enough to prevent further leakage. So with the first herniation, there's like a 15% chance of having a second herniation, and that's what happened to Luke about 5 years later. He started having pain again, and most people who have had it once know that it's come back. So he knew what had happened even before we had the MRI done.
I went back to see Dr. Gorey the second time. After the first one, I knew his team would take very good care of me, and I trusted them. The original plan was to put a full cage in and pins. I did not want to do that due to the limitations I would see afterwards in mobility. And about 2 weeks before the scheduled surgery, he called me and said he had another option.
There were really 3 surgical options. The first one was to do a discectomy again. So that's called a revision discectomy. The challenge with that procedure is there's so much scar tissue that sometimes you can end up getting a nerve injury because the nerve is intimately attached to the scar tissue at the site of the herniation. And I was concerned about that in Luke's case, given his MRI findings where he had a large herniation, lots of scar tissue, and just not enough room to be able to maybe do it as safely as I'd like to. So then you get into fusion options, which involve removing additional sort of bone in the back of the spine to access the disc from a safer location. Traditionally, the way to do a fusion was to use screws, rods, and a cage. But in Luke's case, the other side didn't bother him at all, and all his pathology was just down the leg. So I felt if we limited the surgery to that one side, he may potentially have less surgery done, and as such, have a quicker recovery. So that's where the surgery that he had, which is a freestanding T-lift, so I would remove the joint on that side, access the disc, remove the ruptured disc from a safer window, and then provide stability with a spacer-like device that goes in just from that side.
The Verilift is way less invasive. It was a lot quicker recovery time. I did not lose any mobility, and it helped a lot. It did not have the lasting pain that the first one kind of did. It did not limit my mobility literally from day one. 2 hours after the surgery, I was up walking and moving around, and I could not do that the day before. It has definitely improved my quality of life and allowed me to continue to do the things that I enjoy to do with my wife, kids, friends, and family. One of the main things that it allowed me to do was get back to riding bikes, which I do a few times a week, as well as work on my lowrider truck. I trusted Dr. Gorey a lot to help get my life back to where it was before. I still had many years of work ahead of me and would not have been able to continue the path I was on without the surgery that Dr. Gorey performed. I'd like to thank the care team with Dr. Gorey and Surgery One for putting me back on the path I was in life and allowing me to continue to do things with my children and wife and friends and family. My kids got their dad back.